You don't need surgery, and this is why. When you're having back pain, your body's just taking the path of least resistance. So we're moving too much through the low back. It's so easy to move through this area compared to where the rib cage is and where the pelvis is. There's a lot more stuff going on up here. So if we lack movement up here or we lack movement down here, we're gonna take that movement from here. So we need to get mobility here. We need to stabilize with our abdomen, and we need to get mobility in the hips. We got to get force production. So let's dive right into the steps. It's 10-minute routine, and we're going to fix it right now. The last thing that we're going to do is work on movement patterns. Step number 1 is making sure that our body can move in the right areas. And so we have to work on the soft tissue first. So first thing I'm going to do is find where my pelvis is, and I'm going to take a rolling pin, something, a broomstick, whatever you need to do. And I'm gonna come down and out, loosening up this hip flexor right here. So I do it laying down on the table, and I'm digging into that area for about 1 minute. And then I'll switch and I'll do 1 minute on the opposite side. Just always finding that pelvis, digging down and out, pushing into it. I loosen that up. And then I'm gonna come into a seated position, and I'm gonna loosen up the quad. So one of the quad muscles is a hip flexor. So I'm gonna do 10 swipes coming down. I like to break the quad up into 2 sections. So I'll do 10 swipes right here, and I'm pretty quick about it. And then 10 swipes right on top. And then 10 swipes on the outside. And then I'm gonna do the same thing. 10 swipes outside, 10 swipes on top, 10 swipes on the inside. It looks fun, right? So it's really not that painful, partly because I do it a lot. This is the most tender spot right here. You can kind of see how the muscle's raised up. And then we'll do the other side. This is the most tender spot on this side. You don't have to kill yourself. This is a 3 to a 5, make it uncomfortable but tolerable. And we're just making sure that we're rolling this out and creating glide through these muscles with these hip flexors. So the quads will get really tight on us. The hip flexors, our psoas will get really tight on us, but also our glute max. We got to make sure that our gluteus maximus is moving around. And so what I'm going to do is I'm going to lay down right here. Here's the top of my pelvis. Here's my hip bone. And I'm going to put this right in between where my belt loop is, drop it off to the side, keep my chest and my belt buckle stacked. I'm gonna roll into it, and then I'm just hanging out right here, letting the ball do its work. Gravity and my body weight is just digging down in this ball. If it's too aggressive, if it's really hurting, just come back a little bit, and then you should be okay. So really focus on consistency. We wanna do this routine twice a day. Let's focus on consistency, not hurting ourselves, inflicting a bunch of pain. So I do 1 minute on each side. So I've loosened up all the muscles around my pelvis, and that's gonna take so much stress off your low back. If you think about it, if my shirt down here is like these muscles, our fascia and our muscles are overlapping. If I have a corkscrew, if it's really tight right here, you can see now that's pulling on my back. It pulls my back into extension, and you're just not able to get yourself out of pain. So this simple routine is gonna make a huge impact on your quality of life. Okay, we need to use the glutes. So right after we loosen that up, now I need to use the glutes and lengthen them at the same time. So what I'm gonna do, we call this the active pigeon. So I'm gonna slide this right foot under the left, and I'm coming back right here. I'm allowing my elbows to bend. I wanna keep my back in a neutral position. I'm holding this for about 5 seconds, and then I'm doing 1, 2, 3, 4, 5. Then I come back down, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then I sit down in it, counting to 5. And then slowly I'm engaging that glute to bring me back up. And then I'm sliding back down, sitting there for 5 seconds, and then engaging that glute to come back up. When we do this, it's called PNF stretching. And so what it does is when we engage that muscle, we're able to get more length in it afterwards. So we loosened up the muscle, and now we're getting length. Now I'm just gonna switch on the other side. I'm engaging the muscle and I'm getting more length. And this feels really good right here. My left hip tends to be a little bit more tight than my right hip, and that you're gonna have that in your body too. We have imbalances. We're trying to balance it out, but we gotta make sure that we're engaging the right areas and then not doing this with our back and going into extension. That's gonna cause us more problems. So I keep my back in neutral, driving down, then drive my body back up, coming back down, and drive my body back up, coming back down. And I'm doing that 5 times. So now I've loosened that up. I've engaged the glute, but I've also lengthened the glute. So when I'm walking around, changing direction, I can keep my Superman, Superwoman emblem stacked over my belt buckle because I've created that hip mobility to be able to do it. If I don't have the hip mobility or the hip activation, then I start doing this. I sling my head, and so now I'm leading through my back, and that starts causing us to have this problem over and over. And typically it's death of 1,000 cuts. It's a chop, 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 chop. We just keep chipping away at it, and our body's never able to get rid of that inflammation. And that's what we're gonna change with this program. We gotta get rid of that inflammation. We gotta do it consistently. So we worked on loosening things up, and then now engaging the glutes and getting length in those glute muscles. Now we're gonna engage them in standing. So we call these side steps, and it's really important that we get the right form on this. So I'm gonna go above the knee. My next progression 2 weeks from now would be below the knee. And then 2 weeks after that, we're gonna go at the ankle. We can stick with the same exercise, we just make it a little bit harder with longer lever arms. So what I'm gonna do is go with my feet shoulder width, and I'm gonna point my toes inward. So mine are about straight right here. If I turn them out, I'm gonna use a hip flexor instead of using my glutes. So I'm gonna turn them slightly in. I'm gonna go into my hinge position, a good athletic position right here, and I'm gonna do 1-inch little steps. So 1, 2, 3, 4, 5. Going back the other way, 1, 2, 3, 4, 5. Now, as you get tired, you're gonna be compelled to turn this foot out. That lead foot starts to turn. We wanna make sure that we pigeon toe. Get pigeon toed and get 5 reps. Going back the other way, pigeon toed, get 5 reps. We're doing 3 of them. We get a total of 15 reps. Your butt should be burning. Glutes should be burning on this one. If you take too big of a step, now we've lost that engagement of the glute. We're not using it nearly as much. We want to make sure that the femur at the bottom is pushing out. So that's why we go shoulder width, 1-inch little steps, making sure that we're consistent with this and turning those toes in. And that's it. Now we did 5 side steps, set of 5 each way. We have our resistance going on both legs. So we're working the entire time. So we got a total of 15 with going each direction. And so we knocked that out. So the last step in this 10-minute routine is doing our hip hinge. And this is where we are really working on our movement patterns. If you want to pick something up from the ground and you bend like this, we're bending with our back. So if I bend over, I'm bending with my back, I'm gonna have back pain all the time. If your back's bothering you, a lot of times you'll do this. We'll try to keep the back straight, but now my knees start burning. What we wanna do is we wanna get close to whatever object we're picking up. We kick our butt back, we allow the chest to come down, we push our knees out slightly. Now my back's in a neutral position, my knees are behind the toes, I can pick that up and my hips shift forward. So we're gonna work on that. We do it right here. We'll do it against a wall or we'll do it against a table. We measure our foot away from the wall. This movement pattern of the hip hinge is a linchpin in any back pain, sciatica case. We gotta make sure that we get this hip hinge down because this is what you're gonna be doing. We gotta make it takes about 320 to 360 repetitions for our nervous system to start moving in this pattern. So we really got to practice it. And that's why we do it twice a day, do it consistently. Within 2 weeks, you're going to be way over 300 reps. So we're going to do 15 reps, pushing back, allowing the chest to come down. I'm pushing backward with my hips, forward with my hips, backward with my hips, forward with my hips. And I'm not really touching the table because it's too high. So I'm going to go a little bit closer. It's always good to start a little bit closer because you're going to get The further you go, the more challenging it is, the more likely we are to compensate with things that we've already been doing. And since you've been having back pain, we're probably doing a lot of this stuff a little bit funky. And I'm guilty of it too. At 19, I had a back injury that made me want to become a physical therapist and learn all this stuff. So now I just got to stay really consistent with all this stuff so that I don't have back pain. I still have 2 bulging discs, but my back is the least of my problems. Bigger problem is what my wife makes me do when I get home and I have to unload the dishwasher. Now we're talking about real problems. So I'm gonna shift my hips back and I'm touching this table each time. Face stays in line with the chest. So I'm kind of looking. If you lock eyes on the wall, what ends up happening is you do this, and now I'm doing back extension. As soon as you start feeling it in your low back, we're doing it wrong. So if you start feeling in your low back, I wanna stop, take a step, walk back, rewatch the video. You know, something that's really helpful for you too is when you video yourself and you can kind of see what's going on. If you're in your own house, like take your shirt off, look and see what's happening with your back when you're doing it. So if I'm looking right here, is my back extending like this? That's gonna cause me problems. So I wanna keep sometimes I grab my belly fat to see if I'm extending. If I extend, then I'm digging into my belly and it hurts. So if I don't extend, then it doesn't really hurt. So, and then sometimes it helps people, I say, act like a robot, and you go, I don't know if that's a crane or a robot, but this is nice and controlled. It's not too fast, it's not too slow. I really feel it in the hamstrings and the glutes. If you don't feel your glutes right now, that's okay. Another way to do it that's helpful a lot of times is pushing pressure. So this is one unit with my upper body. I'm gonna put pressure from my abdomen, pushing down into my thighs with my hands. Touch, forward, touch, forward. So I'm putting pressure, I'm using my abs at the same time, and I'm just doing 2 sets of 15. Surgeons are in the business of doing surgery. So if you go to a surgeon with back pain, typically the first thing they're gonna say, they're gonna give you options on surgeries that you can do because that's what they sell, right? So they really don't like it when we fix back pain without a surgical intervention. A really good surgeon is busy all the time and they want you to get fixed without surgery. They don't want to do surgery because there are people that need surgery, but it's not 80% of the back surgeries that we see typically can be prevented, right? And so we want to turn over every stone because once you fuse the back, it can never go back to its original design. We'll never get the back to its original design because we get 2 to 5 millimeters of movement from each segment in the lumbar spine. And so if we fuse 2 segments together, now we've got 2 to 5 millimeters of movement. If we fuse 3 segments, so 2 joints, then we've lost 4 to 10 millimeters of movement, and that has to come from somewhere. And that's where they call the waterfall effect, where the segments above and below just start to get beat up more and more because they're taking on the stress from where you had your surgery. Now we're fused, it doesn't move. I've got to get that movement from somewhere. So we want to prevent as many surgeries as possible, and you're in luck because this video dives in exactly what doctors don't want you to know. We're going to make sure that you are knowing exactly what you need to do to consistently keep yourself out of back pain. Make sure that you subscribe to the channel and leave us comments. Let us know what's not clear, what exactly you need help with, because you can fix this from your house with the right information and the right consistency. We'll make sure that we get this fixed. We'll see you in the next video.